And we say good morning and welcome, Sherry Schmidt from Medicap Pharmacy.
Welcome. It's good to be here.
Good to see you again. And we're going to talk about something that I think a lot of people have to realize they are susceptible to, having something that we're just getting more and more information about nowadays. We saw commercials, national commercials involving Terry Bradshaw to draw attention to what we're going to talk about here recently, and opening up a lot of eyes, isn't it?
It is. So shingles, 1 in 3 people in the United States will get shingles, and about 1 million people get shingles every single year. So anyone who has had chickenpox is at risk of getting shingles. So,
really?
And kind of describe, what does shingles mean?
So what shingles is so when you were a kid and you had chickenpox, even if you didn't know it, I think they say actually like 90% of the U.S. population over age 40 has had shingles, whether they know that or not. So you get chickenpox, that virus kind of lives and stays dormant in some dorsal nerve ganglia, and then later on in your life when you become immune suppressed, and that can be due to stress, medications, disease states, or even just aging, that virus can reactivate and it kind of travels the nerve path, comes to the surface, and that's what we see as shingles.
Yeah, we saw some of those pictures there.
Yeah.
So is it like a scaly, feeling on the skin, or what's it like?
It's a blistery rash. Usually people will actually notice like the pain or irritation sometimes before they even see the rash. So the rash will usually show up a few days later, but most people describe it as a very intense burning sensation. So burning more so than itching, very, very painful. And usually that rash will clear up in about 7 to 10 days. The most common side effect from shingles, though, is something that we call post-herpetic neuralgia. And basically what that means is that for months or even years after the rash is cleared up, people can experience an intense pain. Still. And
really?
It can kind of come and go at different times. Sometimes it's present all the time. So that's really the most common side effect. As well as it can sometimes cause, depending on where, if it's on your face, it
As
can
I say,
cause,
where does it usually pop up, or why is it often misdiagnosed?
It can be anywhere. Common places are the face. We worry about involving the eye and having, vision issues with it. Around the waist is another common area, but because it is activated in that nerve and kind of travels to the skin, we typically only see it on one side of the body. So it really can be anywhere.
Wow.
But
now you get the shingles, and then you said it goes away after a week or so, but then you're still going to have the pain for some time later. Now, do the shingles come back in the future?
You can get shingles a second time. It just kind of depends again on your immune system. So, but people who have had shingles are not immune from getting them again, I guess, is basically how I would say that.
So what are we supposed to do? If we feel or see something that looks like shingles, do we go to our doctor or our pharmacy?
Absolutely.
Just stay home and rest? What's protocol?
Absolutely. So if you think you may have shingles, you want to get to your physician as quickly as possible, because there are some antiviral medications. Sometimes they'll use some steroids, things for pain, things they can do that might help lessen the severity of it or help make it go away quicker. Also, there are some things that they can give you for the nerve pain. But the best way is to actually prevent getting shingles in the first place.
That's the best one?
The best one. And we actually do have a new vaccine. So you may have heard of Zostavax. I think that's actually the Terry Bradshaw commercial.
Is it? Okay.
So Zostavax has been around for several years. It's been a good vaccine, but what they've found is that it's only been about 50 to 60% effective at completely preventing shingles.
Okay.
And about a little bit more effective, maybe 70% effective or so at preventing the pain that goes along with it. So if you get vaccinated with the Zostavax and then you get shingles later, it should be a less severe form of the disease. But what they've learned over time is that the older you were, maybe depending on what other diseases that you had, maybe you didn't build as good of an immune response, and in everyone that immune response has been waning to the point of 4 to 10 years afterwards, it's only about 30% effective.
Okay.
So they've been kind of looking for a solution to all
now,
that.
Is this contagious? Is this something you want to make sure?
That's a good question. We actually get that question a lot. So because it's a reactivation of that chickenpox virus, if you have had chickenpox, it's not contagious because that virus is already living in you.
Okay.
But if you have not had chickenpox or been vaccinated for it, then you could get chickenpox. So like, let's say you had a small child that hadn't been vaccinated yet and they were exposed to someone with shingles, they could get chickenpox.
Oh, okay.
But you can't actually get shingles from someone else.
Got it.
But we do sometimes see, like, stress and different things, especially the death of a loved one, where there may be a couple people in a family that get it. It seems like it's contagious, but really not so much.
So at what age or when is a good time to get this vaccination?
So the new vaccine is actually recommended for people 50 and older, so that's a little bit younger than the Zostavax. And the really good thing about it is that it has shown to be 90% or more effective in every age group.
Wow.
So
Wonderful.
50 and older, which the biggest change is for those 70 and older, because in the 70 and older with the Zostavax, we saw some lower immune responses. So 50 and older, 90% effective, does not seem to show any waning of effectiveness at this point in time. So they've studied it, I think, up to 10 years. So it is a little bit different in that it is not a live vaccine, which is also kind of a positive. It's still only recommended for those who have a healthy immune system, although because it's not live, they are studying it in other age groups at this point, or other immune. So maybe people going through chemotherapy or that have had a transplant
might still be able to get it.
Still be able to get it, and we're doing some studies on that now. The biggest difference is that it's 2 injections. So you get the first one, and then you need to get a second one 2 to 6 months later.
Got it.
And the other big difference is the Zostavax we used to kind of give in some fatty tissue at the back of the arm.
Okay.
You could get a little bit of a rash from that, but this new one is given intramuscularly like a flu shot is. So we do tend to see more injection site reactions. So more soreness, redness, irritation. And to some people, that soreness may prevent them from doing some of their daily activities.
If we want more information, can we just head to one of our local medicap
Absolutely
pharmacies?
can. You can head to one of your local medicap pharmacies. We give the Shingrix immunizations there. You can ask us if you're a candidate for it. We can let you know if your insurance would cover it. So we can definitely help you out.
And we want to let people know very quickly you've added something else to your medicap pharmacy location.
We have. So I think you just saw our list of locations. So not only are we adding locations, but we're also adding services. So we now carry breast pumps and supplies, and we can bill insurances sometimes for those. And we also have specialty medications. So some of the more expensive medications that maybe people have been getting mail order, now they can get from their local pharmacy, and we can help them learn to use that and monitor it.
That works.
And it's not as available as you think. So
It's
medicap
not.
pharmacy really stepping up to make sure moms are being taken care of.
We are definitely trying
Thank
to
you
help
so
out.
much.
Wonderful.
Yeah, thanks for
Thank
having
you.
me.
Great to see you. Wonderful information this morning.
All right, it's 8:21. Don't go too far. We have the Cop Man coming in next on CWI Live.